Welcome to the Robert Wood Johnson Foundation 2017 Culture of Health Prize Ceremony. A lot of energy in the room. So the drum, by the way, is one of our prize traditions. It's a connection to our 2014 winner, Taos Pueblo. We have some of our guests from Taos Pueblo. And this was a gift that was given to us. They were our first winner, by the way, from Indian country. We have many more since then. So this is one way we keep the connection and the thread going throughout the prize communities. I'm Joe Marks with the Robert Wood Johnson Foundation. And I also want to give a special welcome to all of those who are joining us through the live webcast today, watching at home. We are here in Princeton, New Jersey, at the Foundation's atrium with staff and partners from around the country and our 35 now Culture of Health prize-winning communities. 35. And that includes this year's winners, which we'll get to in a moment. Just a couple of things, especially for those watching, but also for those in the room. We have a Facebook Live chat that's happening later this afternoon at 4 p.m., and that will be our President and CEO, Rich Besser of the Robert Wood Johnson Foundation, talking with young leaders from 3 of our prize communities. So please stay tuned for that. For those out there, we hope you will follow us on Facebook, like us on Facebook. There will be more details about the Facebook Live event. And please share the inspiring stories of our prize-winning communities on social media. And when you do that with your networks, your friends, your neighbors, please use the hashtag #CultureOfHealthPrize. So now let's get to it. We have a lot to celebrate today. And to kick it off, I want to welcome RWJF President and CEO, Rich Besser. Rich?
Thanks very much, Joe. It is truly a pleasure to be here. I want to extend a warm welcome to our prize winners, our previous prize winners, our partners, my foundation colleagues, to the prize team at the University of Wisconsin Population Health Institute, to all of you who are joining us on the webcast, and especially those folks who are in prize-winning communities who are watching and enjoying the celebration. You're winners as well, and we're so thrilled you're with us today. As Joe said, this is the 5-year anniversary of the Culture of Health Prize. 35 outstanding communities have won this prize, and that is absolutely incredible. I've heard directly from some of you about the challenges that you face. Your work is hard. It may take years to hit your stride, and it takes dedication and persistence. And I've not witnessed a shortage of dedication and persistence. You as a community really represent that in an amazing way. And one of the things that I hear over and over again is that the prize represents a recognition. It's a recognition of the hard work that you do. Some of you have called it a boost in energy, which is terrific. Fuel to keep you going. So over the next 2 days, you're going to get a lot more fuel. I think jet fuel from each other as you feed off the ideas you're hearing. I hear last night it was a feeding frenzy as ideas were being kicked around over at the Marriott. And you know, there's a lot of work going on, but also it sounds like a lot of fun involved. You know, our hope is that other communities hear your stories and want to get on board. They see what's possible across America, what's possible in their communities to make a difference. I'm really new to this. I've been here for all of 6 months. So I have so much to learn from all of you. It's, to me, an absolute privilege to be in this room and to hear the work that you're doing and hear how our work is supporting your efforts, but more importantly, hear from you what we can do to make you more successful and to help other communities get on board with this. Just a few weeks ago, I had the opportunity to travel to Allen County, Kansas. Allen County in the room? I told them that I have no favorites, okay? I could only go to one community for the announcement, and I went to Allen County, Kansas. So there are no favorites, but I gotta say, I had an amazing time in Allen County, Kansas. There I experienced this can-do spirit that I know is a common thread for all of the communities. It was people working side by side in common purpose. Sitting around in a community circle and hearing from people in the community why they were involved in this, why they thought this was important, what it meant to them and the future of their communities. Some talked about health, some talked about economy, but the common thread was really a faith and a belief that they could help build a better future. And as I watch your videos and I read your stories, that's something that I see in common, this belief that the future can be better for our children and for our children's children. All right, so on to the 2017 prize winners. This is your moment to shine. I hope that you pause and you reflect on how far you've come, that you really enjoy the celebration of the incredible achievement that we are recognizing. Just to start, will all of the 2017 winners please stand and join us in a round of applause. As we continue our journey together, building a culture of health, we all know that there are so many places that need to hear your stories, need to hear your messages, need to get this sense of hope. And we have a shared responsibility to make that happen, to learn together, to trust together, and to be the change that we really want to see. You're showing us that the vision of building a culture of health for everyone in America is doable. And it's doable because you're doing it, and that's really important. You can have a vision of what it looks like, but when you see on the ground what it takes to come together and make it happen, that's what is really so incredible. So many of you have stepped out of your comfort zones. You've worked with people in different fields that you maybe never thought you would be working with. You've confronted tough issues of racism and bigotry. You've acknowledged that we're all in this together to build fair and just communities for all. And that's really profound because, the time has come for our country to make a shift in how we view health and what it takes to truly build communities that allow everyone to be healthy. Be intentional in figuring out how we work together. Give us ideas of how we bring communities together to make this happen, how we can use our influence, how you can use your influence to have even more impact. Today we honor 8 outstanding communities who are doing exactly that. Congratulations again for being prize winners. Thank you for showing us what's possible. Now to introduce our winners, I want to welcome Julie Willems Van Dyke, our incredible partner and friend. Yes. Julie directs the county health rankings and roadmaps and the Culture of Health Prize. Julie and I had a trip out to Kansas together. We visited Allen County together. We ate barbecue, really good barbecue. And I've learned a lot from her already, and I know that doesn't surprise all of you who have been working with her. So Julie, would you do the honors to introduce our first video?
Great. On the shores of Lake Michigan, the 3,162 people of Algoma, Wisconsin, are working together, arm in arm, from young to old, to live Algoma. Let's learn what that means.
Algoma, Wisconsin rests on the shores of Lake Michigan, about 50 miles east of Green Bay. Long known as a mecca for sport fishing, the town is also in the heart of dairy country. Algoma's 3,000-plus residents were recently stung by the closing of one of their largest employers, a manufacturing company, at a cost of some 300 jobs. But the community rallied from that and other challenges, coming together to advance an innovative wellness agenda known as Live Algoma.
Live Algoma is a way that we can try to promote wellness, but this is also financial.
Live Algoma was truly a coalition of people.
To me, Live Algoma is the way people work together.
It's like our culture now.
Community Wellness Center, that's an envy of every community around.
The Wellness Center is connected to the Algoma School District. The two facilities together really bridged many gaps between our youth and the older generation. It makes my heart sing when I go into a room and I see someone who's 80 next to someone who's 16.
It's something we all need to do to keep out of the nursing home for one day.
Maybe you just need some ideas on how to eat right, or maybe you need to stop in and check in with Jody every once in a while.
How are you doing today?
I am a community nurse activator, and I'm available to all community members for free. They can see me for health coaching. They can talk to me about nutrition, weight loss, any of those things. Wolf Tech is a place that's attached to our high school where youth can learn skills that are ready for the manufacturing workforce.
Our company decided that we were going to take one of our printing presses and we were going to bring it up here and we would introduce them to the basics of printing.
I love it because it's a very precise job. Everything has to be done to a certain standard.
Well, where do you get new ideas from? You get new ideas from your youth.
You're going to take your dominant hand and move your other hand through.
Hands-Only CPR started with the American Heart Association and Bellin Health. They donated some mannequins and they asked the kids to do something creative with them. The students thought, you know, if we could make an aim that we could train 47 people at the next basketball game, could we accomplish that? And they ended up actually training well over 100.
We started picking other events that we knew our community members would be attending. Now our goal is to train 3,000 people by December 31st.
Well, you guys are doing a great job.
East Shore Industries is a place in our town that has adults with disabilities that are able to be employed. It's also a place where they can connect with the community.
Nice job.
When my students have a chance to interact with our East Shore Industry clients, they have a chance to give back and to see their strengths.
They just seem excited and just kind of makes me excited whenever they're so happy about it.
East Shore Industries is a big part of Erica's life. It's a place where she can feel safe and comfortable with peers. We are so blessed to have a place like East Shore in Algoma.
The Algoma is made on volunteerism. You can't pull things off unless you have everybody working together.
I step into a community conversation. We could have youth at the table. We could have formal leaders working with untapped leaders. That's exciting to see.
The people that we've met in the last 3 years gives me a whole lot of hope that there's a lot of really cool stuff about to happen.
Please welcome from Algoma, Wisconsin, Nick Koshard, who's the superintendent of the Algoma School District, and Jody Anderson, who is a community nurse activator from Bellin Health? Bellin Health. Welcome. A wonderful video, a wonderful story. And what I've heard is that Live Algoma has become a way of life for residents in the community. How have you seen this program make change in Algoma?
I think the biggest way is that people are willing to look at some of our challenges in our community, and then we wrap around the resources that we need to solve that problem. Certainly if you look at our framework for Live Algoma and the 5 areas that we focus on, it really tries to cut across the barriers that exist between systems so that we can all talk on the same level. And when we can do that, we can provide the opportunities that our community needs and can prosper from.
You know, one of the things I noticed in the video was the engagement of youth. What is it about engaging youth in this that you think is so important?
I think it reframes the way we look at youth. I think a lot of times in a lot of communities, the youth are disregarded and they are not part of the solution. And for us in Algoma, youth are at the forefront of what we do. And we listen to them. The mayor talked a lot about that in the video. And there are some students in our school district that we have learned so much from. And we've also been able to provide them a platform to talk about what they need and what they want to improve in our community. And that's what I'm most hopeful about, is to see those kids and what they're going to be able to do in the very near future.
Jody, I know in many places like Algoma, health systems are moving beyond simply being providers of medical care and really investing in community health. Can you tell us a little bit more about what you and Bellin Health are doing to contribute to community health?
Well, I'm very fortunate to work for a healthcare organization that understands that your health is really wherever you are. So it allows me as a registered nurse to be outside of the walls of the clinic and the hospital system and to really meet people where they're at. So whether that's at their employers or at the school district, maybe it's at the Algoma Community Wellness Center or possibly even the Algoma Public Library. And meeting people where they're at, and some really great things are happening because of that. We are closing gaps in care, so getting people the right care at the right time. We're connecting people back to the community resources, the assets, and then building up those support networks. And I think most importantly, we're connecting them back to their own health. So not just health from the standpoint of medical care or like biometrics, blood pressure, diabetes, but really what matters to them, and that's from the standpoint of well-being. So really that multi-dimensional approach.
So for both of you, what's the one thing you'd like people here, people who are watching, to know about Algoma?
I think just that it's possible, and that if you really want to improve and you surround yourself with the right people at the right time, anything's possible. And I think Algoma has done a wonderful job of fostering that and allowing that to happen across a lot of different sectors, and then more importantly, listening to our youth and allowing them to step forward and really pave the way for us in the future.
Anything to add?
I would say, a small town focusing on the big possibilities, and we're really a community of action and continuous improvement, and that improvement is really being led by our youth. But we don't have it all figured out. I think we need to be humble, but we're certainly learning and growing together.
Well, there's a lot that we can learn from you, and thank you for sharing your story.
Thank you. So, from Iola to Moran, from La Harpe to Humboldt, the 13,000 people of Allen County, often described as scrappy and resourceful, recognize that building health also means addressing poverty. Let's learn more.
Allen County is a rural community in southeastern Kansas. For decades, it has been slowly losing population, a trend that taxed the physical and economic health of the community. But Allen County is breaking the cycle with a combination of pride, planning, and partnerships.
We aren't rich. We're scrappy. Our best asset is our people.
People judge you by your character rather than what you have or what you don't have.
I am always looking for ways to get things done around here. Some way might not work, we try a different way.
Allen County has 13,000 people spread across 505 square miles. We've had to be intentional about creating opportunities for community conversations.
Get people together and get them expressing what we need, what we want, how we could be serving each other better.
You have to communicate. You have to make people believe in themselves.
Thrive is a convener. It's an organization that can take ideas and make them real. We don't do the work, the people do the work. We look at data, we test, we learn. We've made it over a huge hurdle as a community, from the whether to the how.
MARV stands for Mills and Reading Vehicle. The kids know we're coming, and yes, we honk as we're driving up so they know that we're here. Part of getting healthy adults is you have to get healthy children. I truly am a believer that we are going to cut down on obesity, diabetes, heart disease, but it has to start with feeding kids healthy meals, because that's where health starts.
We do everything from aluminum cans to combines. If it's metal, we'll buy it. I looked around the area and decided that we needed some workers around here. You know, people that knew how to do things with their hands.
So he put his money where his mouth is by buying a former lumberyard complex and donating buildings on that complex so that it could become the Regional Rural Technology Center.
Keep the jobs here, keep them here. That's what we're hoping to do, train kids and try to keep them home.
10 years ago, we started by saying, let's build trails and let's work on sidewalks and connectivity. We were overrun with people using them. There's been a concerted effort over the last several years to bring a retail bike shop to Allen County. It's been a huge success.
So this has to move in order to keep the chain tight, otherwise the chain will fall off.
So we're talking about health, we're talking about physical activity, we're talking about economic development, and we're talking about new opportunities to socialize. You weave these elements together, and then you've got a culture of health.
Please welcome from Allen County, Kansas, Angela Henry, who is the director of Safe Base After School Program, and David Tulland, who is the CEO of Thrive Allen County. Thanks so much for joining us. So as I mentioned, I came out and visited Allen County, and David, what I saw was this can-do spirit, something that's been described as scrappy, but I saw it more as this belief of what's possible. And in talking to you, it really involved a change in mindset. How did you go about getting people to see things that may have been at one point seen as a liability into seeing them as a potential, as a possibility?
Well, there's this national narrative that says that rural communities and small towns aren't quite as good as the rest of the world. And we reject that as a community. We really do, because we believe that, that all people have an opportunity to live great lives regardless of where they are. For us, that's meant that we need to look at the way we live, the way we work, the way we play, and look at our surroundings and turn liabilities into assets. So an example of that is the Lehigh-Portland Trails, where the community took a former cement plant, and it had been abandoned in 1970, and turned that complex into a network of trails that are used by everybody for recreational purposes to, we use it in recruiting physicians as a way to show what's possible in our town. And so it's been a really creative, I guess, blending of approaches.
And everyone was on board with that from the beginning, right?
Well, you know, it's difficult anywhere to get everyone on board, but it's remarkable how much there is this common goal and common vision, which is that we don't want to just survive, you know, we want to thrive in the long term. And people have bought into that, and we're proud because in most small communities, rural communities, we've been losing for a long time. It's, in our community, we're down from 30,000 residents in 1920 to 13,000 today. And so there's this idea that maybe tomorrow won't be as good as today. I think we've turned that on its head, and our people have shown that tomorrow can be better.
Angela, I know you guys are doing so much to invest in youth, in building a culture of health. Can you tell us a little bit more about how you're doing that to be sure that this work endures?
Absolutely. So in Allen County, we're growing our biggest asset. We're investing in our youth. And whether that is the city council members, the county commissioners providing us vital funds that we need to expand our programs, whether that's the sheriff's department coming with county staff to help our program create the first school-based garden, whether that is Mr. Maloney buying a vacant building to create this wonderful new tech center, we are striving to create equal opportunity so that all of our students and youth can find success for themselves, whatever that means. Specifically for Safe Base, besides doing academic and enrichment and helping working families, we realized that we had dental issues with our students, that there were things that we needed to help solve. And so we came together with volunteering dentists, local service clubs, and over the course of 6 years, we expanded this program countywide. We provided 5,000 student screenings, and we provided follow-up dental treatment to over 700 students. One story that sticks out to me, we had an all-night middle school dance, which was exciting, but we raised $2,500, and what that equated to, for us was that 5 Allen County kids could have braces. One of the students who received braces is now 26, and he is our newest elected council person. And that is how we are investing, and that's how we are changing generationally the work that we're doing. And we appreciate being here.
Awesome.
One last question for the two of you. What do you want others to take away and learn from your experience in Allen County?
I think we want people to know that while this is the Culture of Health Prize and people think health nationally, I think people think health is about what happens in the doctor's office. To us, it's been, yes, about what happens in the doctor's office, but also what happens in the principal's office, or what happens in the banker's office, or what happens when you're having a conversation at the garage with the guy who's fixing your car. And so we're agnostic about approaches. We've tried a lot of different ways to turn our community around, and what we've found is that having a common vision of a culture of health is a way to make it happen and get it done.
Angela, anything to add?
Just that we've learned so much from others that we've been able to implement, that we're willing to help anybody else. And I think we both, as well as our community, feels very hopeful for our future.
Terrific. Thanks so much.
Thank you. Like a phoenix rising from the ashes of bankruptcy and industrial grit, Chelsea has become a diverse, welcoming, and inclusive city, reclaiming its environment and assuring no one falls through the cracks. Let's learn more.
Chelsea, Massachusetts is the state's smallest city, and it's one of the most diverse, long drawing both immigrants and industry. Chelsea was bankrupt 2 decades ago. Now it's filled with lush gardens, new schools, and thriving businesses. Little Chelsea is in an enormous turnaround.
Historically, Chelsea struggled from a culture of corruption and lack of faith in local government. It has risen from those ashes to really become an extraordinary city.
Chelsea has tackled environmental justice issues for over 20 years now, and residents are dealing with some really significant health challenges, and we strongly believe this correlates with environmental burdens. Residents are at the forefront of this fight for environmental justice.
The retrofitting of the machinery at the Produce Center was a great example of a collaborative effort between a local industry and Green Roots to reduce their air quality impact.
Residents are challenging some of the polluters. They're challenging government to be more accountable to the residents of Chelsea.
We have to make sure that we're doing everything that we can so that that future that we want is the future that we get.
Today is our last neighborhood walk for summer. A lot of the folks that live in our community are disenfranchised, are very vulnerable. So it's always good to bring them to the table so that they can be part of the change that is happening. If you ever have ideas on how to make our community safer, you can always come out. We believe that if our community is a space where people feel welcome and they feel heard, then folks can thrive in it.
The Hub is a place where a number of different community-based organizations and healthcare providers come together with the police department, and they talk about specific and immediate cases.
They meet once a week, and then we look at issues of individuals or families that are highly at risk. We mobilize teams on who can intervene.
Through a partnership of numerous different organizations, together with the police department in the city of Chelsea, we have these navigators that are going out into the community and working with those who are most impacted by substance abuse or homelessness and other challenges.
My job is to help people. Whatever issues they may have, whatever services they may require, it's my job to try to get them there.
People need to be connected with others, and that's how we're going to be able to get people back on their feet.
Mass General Health Center, the Chelsea campus here, is a backbone of health and wellness for our community.
Community health workers really address the barriers to care for individuals in this community.
Because of the community health workers, there's less emergency room visits or urgent care visits.
What are the conditions?
Healthy Chelsea is a coalition of multiple different community stakeholders and partners working to advance health initiatives in the city.
We use multi-sector partnerships to really address obesity within the community. The school system has been a big partner with both healthy eating and active living work, and as a result, they have reduced sugar intake, they've reduced sodium intake, which is fantastic.
Chelsea's on the right track. Our community could sit back and say, woe is us, or we could continue to fight and persevere and be the powerful city we are.
The people, they're fighters, every one of us.
Please welcome from Chelsea, Massachusetts, Jose Ireta, the Community Engagement Manager for Chelsea Thrives, and Roseanne Bongiovanni, the Executive Director of Green Roots. Wonderful to have a chance to speak with you both. When we talk about building a culture of health, one of the things that we talk about a lot is the importance of inclusion and diversity. How does that fuel the work that you do in Chelsea?
That's the model that we live by in Chelsea. Diversity, inclusivity is at the heart of every single thing that we do. As you saw from our video, Chelsea's 1.8 square miles. It's a really tiny community, and everybody thinks of Boston, but they don't necessarily recognize the vital benefits that a nearby community of Chelsea provides for the entire region. You know, our community is storing 100% of the jet fuel that's used at Logan International Airport and 70 to 80% of the region's heating fuel. Road salt for 350 communities, and the New England Produce Center, which provides produce to all of the mid-Atlantic states and some Canadian states. And yet our residents, there are more than 40,000 of us that live within those 1.8 square miles, are some of the poorest in the state. 24% of our population falls below the poverty levels, and there are more than 30 languages spoken in Chelsea public schools. Residents from Chelsea are coming from all over the world to find a better way of life, and it doesn't make a difference if you're coming from Italy, Afghanistan, Central America, South America. We're here to work together, to work collaboratively. We're empowering one another to change our trajectory so that our community is healthier, more powerful, and better off in the long run.
For many years, you've worked in the area of environmental justice. And when many people think about health, environmental justice isn't the first thing that comes to mind. How do you make the connection between environmental justice and the health of a community?
Yeah, absolutely. It's a great question. So we want to make sure that our residents have access to some of the beautiful things you've seen in some of these other videos, like parks and open spaces and trails. And in a small, very densely populated urban community like Chelsea, we don't have that same opportunity to have that access. And so we work little by little to make sure that residents see that they live on a waterfront, that they do have a sense of environment, even if it is very urban and very small patches. And so we meet folks where they're at and try and engage them in the work that we're doing to make sure that they have the opportunities that so many other wealthier communities have.
Jose, you know, when we talk about inclusivity, sometimes it seems like a really vague, broad concept. Can you give us a personal example of how that has played out in Chelsea and how you all live and make decisions?
Of course, I'll be happy to.
Great.
I can speak about my experience. So my family migrated from El Salvador to the United States. And for a period of time, I was out of status in our community, but we found in Chelsea a place where, regardless of whether or not you're documented or you're not, you have a community that is willing to embrace you and lift you up. I remember coming here and becoming a mentor and excelling academically. I was blessed because of all the support around me to get a private scholarship to a private institution. And that's why I decided to come back, because I wanted to be that person that could lift people just like myself and the other people that lifted me up. So in Chelsea, you find a network of people that are willing to help if you're willing to put the work. And we celebrate our differences. We celebrate Hispanic Heritage Month, Recovery Month. And when our most vulnerable people are in danger, we come together and we rally around them. We defend our sanctuary status, and we say, yes, you can feel welcome here, and you will be protected here. So I can only speak about my experience and what I'm trying to replicate for others.
It's an awesome experience, and we really appreciate you sharing and your commitment to replicating it.
Thank you.
So, Rosanna and Jose, the same question that I've asked to the others. What one thing do you want people here and people watching to know and to learn from your experience in Chelsea?
I think I'd like you all to know that Chelsea is a microcosm of all of the good in the world, and similar to Allen County, where you have the can-do spirit, we have the si se puede spirit. It can be done, and we're going to get it done in Chelsea.
That's right. And celebrate differences. You will be surprised of what can come out of a meal, and just great conversation. So have an open mind and open ears, and listen to what others have to say.
Well, thank you and your community for all that you're doing.
At the far western tip of Maryland, in the heart of Appalachia, Garrett County, Maryland is creating a culture of caring by leveraging its assets to tackle intergenerational poverty, to advance health in their community. Let's learn more.
Garrett County, Maryland sits on the eastern edge of the Appalachian Mountains. Home to the state's largest freshwater lake, it boasts a thriving tourism industry. Yet many of the county's 33,000 residents live in isolated communities, work in low-paying seasonal jobs, and struggle with intergenerational poverty. To bridge this gap, Garrett County has learned to rely on its greatest asset, its people.
Meals on Wheels.
People see there's a need, and they don't wait for someone else to do something about it.
As a community, we don't look at our success based on how the upper 10% of the population lives or even the upper 50%, but what's our lower percent of the population, those people who are living in poverty, what's their life like?
The two-generation initiative is focused primarily on the idea that we're working both with the adult and children simultaneously, because children do better if their families do better and vice versa.
We have so many families who don't have the means to travel outside of their communities, so we had to find a way to get to them. Wow, wow, wow! Learning Beyond the Classroom is a bus that we've retrofitted into a mobile classroom, and we travel around Garrett County to 10 different communities. We do school readiness activities, we educate them on nutrition, provide them with healthy food, and it just provides them with so many resources and so many connections.
We really believe that housing should not be categorized by a label called low-income housing or public housing, and so we have designed it in a way that makes it a part of the community.
I'm low income and I'm elderly. They were able to get me started on an independent living situation here at Meadows, and that's amazing.
You'll have a realtor come and explain contracts.
We also run an extensive home ownership program for first-time home buyers and people moving into the county that's resulted in over 400 first-time home buyers.
The issues facing the Appalachian community, of course, are obesity, high blood pressure, diabetes is huge in this area. And I think all of those things combined can be affected by people being active, and this building gives them the opportunity to do that year-round.
Does any of you, just by a show of hands, know somebody that's passed away from an overdose?
We've invested highly in our community in prevention activities.
If you see a friend or loved one and they're going down this path, what are you going to do on them if you love them? You're going to snitch on them, right? That's the right thing to do.
That's the only way we can get ahead of this epidemic that is really sweeping the country.
We live in such a rural area that in order to get treatment, patients would have to travel about an hour, either east or west. So we were finding that many people were delaying treatment or they were not getting treatment at all. Being able to have their treatment here has been life-changing for many patients.
In the fall of 2006, we started the Garrett County Scholarship Program. And under that program, every kid that graduated from high school in Garrett County was eligible to go to Garrett College 2 years tuition-free.
Prelin is an absolutely amazing elementary school.
People see it as a model school because we have such unique programs. In the agriculture program, the kids are responsible for feeding the animals, watering the animals.
All right, how many eggs we got?
You know, and you're building character, you're building that work ethic. I think it starts here, it starts at this young age.
I'm very optimistic about the future of Garrett County.
We're really trying to improve life for folks through any means possible.
There's a lot of people working together. It's going beyond what's expected. That's what happens in Garrett County.
Well, we now welcome from Garrett County, Maryland, Kevin Null, who is the Garrett County Health Administrator, and Bob Stevens, who's the Health Officer with Garrett County Health Department. Thank you so much for the work that you all are doing. Kevin, first question for you. I understand that there was a point in time where you faced a decision whether to expand the jail or to build a rec center. And you decided to build the rec center, and this has become a hub within the community. Why the decision? How did you come about doing this? Tell us more.
Well, the process was certainly controversial. The jail is something that every community needs, unfortunately, but it's been something that we, as a community, felt we needed to invest in the health and the well-being of the community and prevent people from going to jail. So how can we intervene through health, through education, through recreation to prevent that?
Was that a hard sell?
Yes, it was a hard sell. It was very controversial, but the elected officials stepped up, and obviously everybody thinks we did the right thing.
The elected officials as well?
Yes.
Yeah.
Bob and Kevin, I was on the site visit that came to Garrett County, and one of the things we were so impressed with and featured in the video was how you are working on education, which we know contributes to how long and how well people live. Can you tell us more about how you've expanded education and career opportunities in Garrett County?
Sure, I'll start with that, and then I'll let Kevin talk about one of the hallmarks of our community. But we've fortunately have had a great education system for a long time. Our primary and secondary school system has always been good. But quite a few years ago, we looked at what else could be done. And we have an initiative in Maryland where we're looking at, we measure children entering school ready to learn. And so we started our Nurse-Family Partnership Program, our Healthy Families Program. In that program, which is at-risk infants, really, but embedded within that team is an educator, and that educator works with those high-risk families in order to help the parents get GEDs, get their education, improve their lot. The two-generation initiative that was spoken about in the video, that's something that's pretty unique to Garrett County, where and Maryland is following suit now with an initiative in the state of Maryland where we kind of led the way, and that's with our Community Action Agency, our Department of Social Services, and other agencies are, when people come in for services, whether it's Head Start for the child or whether it's housing for the adults, they look at the entire family, and they have certain outcomes that they're having the families work on, whether that's having their child enter school ready to learn, but what about their job situation? What about their housing situation? What about their transportation system? And so they're looking very expansively at that. And then I'll let Kevin talk a little bit about one of the things we're very proud of.
Sure, that would be our scholarship program. We recognized that we needed a skilled and highly trained workforce, especially in order to attract new businesses, improve the income of the citizens, and allow more people to stay in the county. As Bob mentioned, even though Garrett County Public Schools is consistently ranked in the top 5 in the state of Maryland, there were barriers to the cost of education. So the county and the county commissioners created a scholarship program in cooperation with our community college, Garrett College. And basically, any graduating senior that graduates from a public school in Carroll County or in Garrett County or a private school or has a GED is eligible for free tuition at Garrett College. It's a two-year college. The college funds this with a combination of financial aid and the county scholarship. In 2010, we expanded that to include workforce development. So the college is offering programs such as welding, truck driving, CNA programs, phlebotomists, veterinary assistants. Last year, we provided 260 scholarships, and since the inception of the program in 2006, we've paid out $4.5 million in scholarships to residents of the county.
So, as a takeaway, what do you want people to know from the experience you've had in Garrett County? What's the takeaway?
One of the things I'd like to highlight is partnerships, and I know that that's been something that we've had to work on for many years. There was a time when community agencies and community groups kind of worked in silos, and over the years we have really learned that we have to work together. So we have a local management board, a behavioral health authority that looks at mental health and addictions across all of the different agencies. We have a drug-free communities coalition. We just have all of these different groups that work together. And one of the things that when you talk about collaboration is hard. You know, that's putting money on the table and putting your hands behind your back and trusting the other people around the table. And that's what we've had to do. We've been able to do that. One of the reasons is for the leadership that we've been fortunate to have over the years who have stayed in leadership positions long enough that they learn to trust each other, and they learn that the culture of Garrett County is to work together and do things collaboratively.
Well, thank you all for your work and for sharing your story with us today, and we look forward to learning from you over the next couple of days.
Thank you.
Richmond, Virginia is tackling its history of racial division that has created entrenched inequities in health, education, and housing. They're doing this by creating the space for frank conversations, setting bold goals around reducing poverty with an explicit strategy to get there. Let's learn more.
Discriminatory policies has created deep and enduring challenges. Now, in these vibrant communities, leaders and residents are coming together to create innovative pathways out of poverty, to invest in the future by supporting children and families, and to build lasting partnerships for progress.
The Office of Community Wealth Building is the only municipal office of its kind in the nation. Our task is to lead the comprehensive community-wide effort to move thousands of Richmonders out of poverty. We have an aspirational goal to reduce the poverty rate by 40% by 2030 for adults and then 50% for children by 2030. The Center for Workforce Innovation is our more holistic approach to getting people employed.
We're going to pull up the job description, and then we're going to apply for it.
We have at least 300 people a week who walk in our office, and these are folks who maybe have given up on looking for a job or face some of those barriers that have prevented them from finding a job that works for them.
So type that up here.
We hope that with each passing day, as they go through training or interact with their case managers there, people see more hopeful possibilities for what they can accomplish as a citizen in Richmond.
There are 12,000 people living in public housing, and more than just that many people living in public housing, they're living in densely concentrated areas of poverty.
It would be like a copay. With Head Start, there won't be.
Community health workers are residents who know firsthand the challenges of life in public housing.
We're helping people navigate the wealth of resources here in Richmond. A community health worker would try to help you tear down the barriers to health. That is ultimately my general mission, to make you self-sufficient and healthy and thriving.
The Peter Paul Development Center focuses on after-school engagement of youth, but really pulls families into that process.
We have access to over 300 children and families in the community. We're making the connections between the families and an array of resources in the community, everything from housing resources to health and wellness, of course, educational initiatives.
The Junior Iron Chef RVA program and competition is a program that engages the child first. We teach the kids culinary skills and nutrition education, and they take that information and knowledge back to their families.
Historically, there haven't been community members at the table. It's been a top-down conversation. I think that if we really want sustainable change to happen in communities, then the solutions to community problems have to come from the community itself.
I am encouraged by some of the recent collaboration that I've seen, especially around health equity in the city. I am seeing some signs of progress with incorporating more of the voice of the community.
I'm incredibly optimistic about what's happening in this city. It's an affirmation of a new way of thinking, of different sectors working together, but at the end, keeping the community that we're serving at the center. And it's an affirmation of a new day in the city.
Well, we welcome from Richmond, Virginia, Dr. Danny Avila, who's the director of the Richmond City Health District, and Reggie Gordon, who is the director of the Office of Community Wealth Building. Thanks so much for your work and for being here. Danny, I wanted to start with you. You've mentioned two things as key to the work you're doing in Richmond. One is this willingness to confront the past, even when that's really hard. And then the other is keeping the community at the center of your work. How do those two things inform what you're doing in Richmond?
Yeah, I'll start with the second first. And
I think there's a reality to the way that we as government have operated for many years, where we check the box of community involvement when we do a survey, or we have a public meeting that maybe 2 or 0 community residents show up to, or we post something online in a format that many of our residents can't actually get to. And I think really tackling that and thinking differently about, are the residents of our communities valued as equal partners in our decision making and our work? And so that is some of the things that are happening at the Office of Community Wealth Building and many other institutions around Richmond. And the first around confronting our past, I think as a health official, when I'm thinking about life expectancy differences or disparities in other health conditions, it's hard to really get to the root of those issues without being honest about the fact that we have done things structurally and systematically over history to create those scenarios, whether that's redlining or the huge consolidation of public housing that's happened in our communities, or laying 95 right through our most prosperous African-American community. There are things that we've done to create these health disparities, and we can't really address them without being honest about that.
In addition, to engaging residents in these tough conversations, you're also looking at the institutions in Richmond, and there are incredible institutions there, educational and health institutions. How are you pulling them into the work that you're trying to do?
Yeah, we are blessed to have 3 large health systems and a large academic center, a large faith-based nonprofit health system, and the private sector system. And we've been meeting as a group. I've facilitated a conversation with the CEOs of those 3 health systems over the last year and a half, who are really authentically interested in how they can both work together and really make a difference in community health. And so, having one of our partners here, Dave Beldy from Bon Secours, having an anchor institution like Bon Secours, who really is energized by a conversation about what happens outside of the hospital, and recognizing that housing and education and economic development are as much a part of creating a healthy community as having a hospital is that. I mean, that changes the conversation for us.
Reggie, I know Richmond is the first community to open an Office of Community Wealth Building. Can you tell us a little bit about why it's important to connect health and wealth?
Yes. We are excited about this inflection point in our history. It took years to organize ourselves around what do we do about these issues that we see that are health-related, socioeconomic related, why so many people are stuck in our community. So there was an anti-poverty commission that met in 2011 with stakeholders from the various subsectors that Danny mentioned, and they decided we needed to have some structure to implement the recommendations. Our office is focused on finding people navigable pathways to get to financial well-being. Once you reach a level of economic stability, the implications are fantastic as far as health outcomes. If you have more money, you'll be able to buy the food that you need, your stress level will go down, the family environment will be more conducive for not only learning, but exercising and exploring all the wonderful assets that we have in our community. So it's taken a while to get there, but we're on the right trajectory now.
Great. And I know, similar to the work Danny's described, you've had an active community engagement component to the work. Can you tell us a little bit more about that?
Community engagement is critical for community wealth building. We are intentional about recognizing the people that are moving forward as the experts. Yes, there are those of us with degrees and backgrounds, and we've researched and studied, and we decided to make sure that we have to have them at the table, not only at the table, but helping us to chart the way forward. Every Friday we have listening sessions in our office, and we invite in not only experts and people who are providers, but also the woman who had trouble at the Department of Social Services or had an issue with transportation. And we ask her to describe her life. And it's been so empowering and invigorating when not only does she describe what happened, but offer a suggestion. And our role as the Office of Community Wealth Building is to take these ideas from the people and bring them back to our tables, if they happen not to be at that table, and say, this should be the answer. We've studied it, but maybe we missed this aspect, and this is the reality for many people in our community.
Great.
So briefly to close out, what one thing would you all like people here and people watching to take away from your experience in Richmond?
Look at the people that we're helping as the experts. We're all in this together. And for Richmond in particular, we're at an important inflection point, as Danny mentioned. We have great partnerships in our community, and it seems like we're all in the right place at the right time. It took us decades to land here, but I hope when we look back on 2017 and this award in particular, we'll know this is when things really began to take shape and change for our community.
Yeah. Thank you both for being here and sharing your story. That's a terrific spot to end. Okay. Thank you.
San Pablo, California, the little city that could, was once known as a hotbed of violence and unemployment. But they are changing that narrative and creating opportunities for jobs, for safety, for inclusion. Let's learn more.
San Pablo is a small and diverse city in Northern California's East Bay. When the jobless rate soared 5 years ago, community leaders made eliminating barriers to employment a priority. Now, residents are beginning to turn a vision of a healthier San Pablo into action.
The connection between economic disparity and health in the city of San Pablo is huge. The Economic Development Corporation is there to create economic opportunity in our own backyard. We can help anybody who's low to moderate income. We are there to develop, diversify, and stabilize the local economy, and we do that through the training and education of both workforce and businesses.
We are a vocational school. Our students go out to work in a barbershop. Most of our students do eventually end up opening their own shop.
EDC provided a grant to finish barber college.
Joaquin Delgado is a San Pablo resident. He enrolled in the Moeller Barber College program. He now co-owns the Barber Lounge, which is amazing.
For EDC to help me out, it was pretty critical. Without them, I don't think I would have got as far as I would have wanted to.
We see this enabling people to get a middle-class life. It's been a very rewarding thing to see.
The Removing Barriers Tattoo Removal Program takes people who are great and have so much potential, but maybe on the surface they're being dismissed. And what we're trying to do is help erase those vestiges of the past. Any others?
You know, when I was 17 years old and I got these tattoos, I wasn't really looking forward to my future. Now that I'm 35, removing my tattoos would open opportunities for better jobs out there. Being a role model for my kids, it's everything to me.
In the city of San Pablo, we believe deeply in inclusivity, and we want to provide a safe place for those residents to come in and truly feel they're a part of the process. Our Brown Bag program provides an opportunity for our seniors to receive fresh produce, and if they can't make it to that day, our paratransit will actually take it to their home or their residence and provide it to them directly. It's nice to see the community want to participate in programs and services that we're offering.
The San Pablo Community Center was something that the San Pablo EDC and the city came together on. We have Zumba, karate, ballet, and other recreation programs that take place in the exercise room. Youth engagement is very important to us. If we don't engage folks early about how important it is to have a voice in shaping their community, then we'll lose them.
Is a group of young individuals that represent the city of San Pablo.
They meet in the city council chambers. They run themselves like a city council.
We started to use our lived experience as young people in the community to shape and inform public policy.
About 5 years ago, we discovered that we had the third highest childhood obesity rate in the state of California.
We're very excited about the Rumrail Sports Complex. It expands our footprint of active park space.
It's built on a former railroad dump site, so we worked with the EPA to do cleanup, and we worked with New Market Tax Credit program in order to bring in that investment, and today we have an incredible park. This community has dug deep. It is still a diamond in the rough, and we know that, but we're going to continue along a path to a healthier, more vibrant San Pablo.
Well, we welcome from San Pablo, California, Raina Schwartz, who is the Assistant City Manager of the City of San Pablo, and Leonard McNeil, who is the former mayor of the City of San Pablo. Thank you both for being here. Leonard, I want to start with you. So you've lived in San Pablo for a long time, since 1956. Yes. How has the community transitioned over that period of time to get to where it is today?
Well, when I moved to San Pablo in 1956, I was 12. And I moved from a predominantly African-American community in North Richmond. And when our family moved to San Pablo was predominantly white. And black people used to refer to San Pablo as the Mississippi of the West. It has migrated and changed in terms of the demographics to a city that is now 89% non-white. And the city councils over a period most recently has become much more diverse. And the new and different and current population has informed the policies now that the city council and public policy is responding to and serving.
Are there specific things that you see have clicked or changed to allow the kind of progress you're seeing now, the work that you're being recognized for now?
Certainly, I have to go back to the policy, but I actually have to go back to, in our city, in all examples that are represented here, they have to do with what I would call capital, financial capital, social capital, human capital. They all come together, and it works like individual to individual, individual to organization, and organization to organization. And there is a culture in San Pablo where people want to get involved, want to serve, and use their capacities to improve the community. So we've been able to do programs that relate to youth development, community development, workforce development, and so forth.
Thank you.
Raina, you know, the Culture of Health Prize recognizes what you've already accomplished, which is clearly a lot. But where does San Pablo go from here? How will you build on this work that you've already accomplished?
Thank you. It's a really exciting time in San Pablo. It's been a really exciting time, and it continues to be. I've been with the city for about 2.5 years, so I feel like I've kind of come in the early phases. We've accomplished so much, but there's so much more to do. Some of the things, and it will be a multi-pronged approach. It's not going to be any one thing that we do, but it's going to be, our city council has made further investments in our full service community schools program. This is a program that really fundamentally brings the city, the community, and the schools together all around creating environments for healthy children and creating better futures for those children. That kind of youth engagement starting in the schools, working through our youth commission, are really going to continue to make a difference for us. We also continue to have economic development and other quality of life changes. We're partnering with the county on a new fire station. We're continuing to redevelop what was a former crime-ridden mobile home site into a health campus and a new city hall and other types of amenities. So in every way, that we've come so far, we can see, and particularly seeing all the communities here, we can see all those next steps coming, programs, projects, conversations. I think all of those things are going to be what we do next.
So the same challenging question that I've asked the others, what do you want other communities to take away from your experience that they might be able to apply to their communities?
If I could just quickly say, the one thing that I want people to take away is don't be drawn in or limited by the story of your past. That is your past. You need to honor it. It is what it is. But don't be limited by it. You can achieve so much more than people will look at you initially and say you can do. Don't believe them.
Leonard?
If I could, I'm an ex-jock, so the analogy I would use would be the touchdown that you scored in the previous game will not help you win the games that's coming up, okay? And so what I'm saying is you can't rest on your laurels. When you set the bar here, you cannot get complacent with it. You have to keep going. Otherwise, you don't have development. One thing I think it's important is to look at government as an entity that promotes the general welfare. And government also, with its community partners, can bring about economic and social justice, and I think it's what it's about. And you have to come together with all the stakeholders and gatekeepers in the community to do that.
Thank you both for sharing your stories and your wonderful lessons.
The Seneca Nation of Indians are making decisions that stand the test of time. And they have to, because they are not only building a culture of health for today, but for 7 generations to come. Let's learn more.
The sovereign territories of the Seneca Nation of Indians comprise some 50,000 acres in western New York State. The nation's forests, fields, and streams have sustained the Senecas for millennia. But the tribe of more than 8,000 members has long faced historical trauma with effects that include high unemployment and substance abuse. In recent years, the nation has been improving its healthcare, employment training, and educational systems, along with a concerted effort to restore the Seneca language and traditional values.
I think about the songs that we have, and they're thousands of years old. Passing that on to the next generation, it's got a special place in my heart.
The mission of the Faith Keeper School is to preserve the language, our culture, instilling it early into the kids.
We're losing our language and losing some of our cultural ways. The Seneca Arts and Learning Center was part of the vision to bring that back with our children.
And Seneca, let's all say Jihopwise.
We're going to raise our children to be strong. We're going to help them get over traumas.
It is a big story, the Kinzua Dam. It's a tragic story.
The removal was very difficult and heartbreaking for our people, in particular those families that had to be removed from their homes. Homes were burned in front of families.
It still has a direct effect on a lot of our members. Some of our members died from broken hearts.
If you're having any feelings of relapse, you're going to call me.
Seneca Strong started in 2014, and it's to help fight the drug and alcohol epidemic we have here on territory. The opioid epidemic is really hitting us hard. I believe because of the underlying trauma that we have, that may be a factor. We've had a lot of funerals.
The opioid epidemic is it's like a monster. It's affected my family. I could say everyone in the community is affected by it.
See how that's starting to brown like this? That's how you want it. Food is our medicine is trying to help our community eat healthier. We're bringing back our traditional foods that we were taught and grown up with, like out from generation to generation. And this is our traditional Iroquois white corn. And this is what it's planted. It's an heirloom corn. Our cornbread was a staple food. And this is made out of the corn flour.
Training people for employment is very important. The better we train our workforce, the better they're going to be able to adapt to a changing society.
We have a very individualized program for anybody who walks in our door.
Seneca Energy and its mission to really create a sustainable energy platform for the entire Seneca Nation.
Our wind turbine has been a long time coming. The nation had this vision about 12 years ago. We also have a significant source of solar. We're really leading the way in Indian country.
We're the caretakers of Mother Earth.
For a Native American, the land is everything. We value the land by making sure it's going to be there for the next 7 generations.
The future of the Seneca Nation, I believe, is in good hands. I have faith, and I always believe that people can change. I have faith in our youth. They're strong, and they'll carry it on into the future.
We welcome from the Seneca Nation of Indians, Darlene Miller, who is the acting administrator of the Faith Keepers School, and Lucille White, who is the director of community planning and development for the Seneca Nation of Indians. Thanks so much for being here. Lucille, you speak very passionately about traditional foods and their connection to health. And I think this goes beyond the pure nutritional value there. What is it about traditional foods that you think are so important?
Well, one of the problems that we face as Native Americans, and I think this is across the border, across the board with all Native Americans, is that we face the epidemic of diabetes. And I always say that even though the numbers may not state it, because we don't count how it affects the family, but I think 98% of us are affected with diabetes. If we don't have it today, the chances are at some point in time we may face it. So it was important to us. We started about 4 years ago working with our tribal council. I'm a member of the board of the Seneca Diabetes Foundation, and this is one of our objects that we feel that we need to take care of. We need to be taking care of the health of our community and working with our community and making those changes. So we approached the council, and the council totally embraced the project of Food is Our Medicine. We began that project by working closely with every aspect of our community to find out from each and every one of them, how do we approach this? How do we make this change, and who do we involve? And they all agreed that we needed to involve every one of us. Obesity is rampant, as it is in many communities. Kids don't move around the way they used to. Even us older people don't. But we started working. We developed the community centers, as you saw in our video. We have these community centers that are there, not quite 24/7, but 7 days a week, providing some kind of an activity for not only the children but also for the adults. And we started beginning to grow our foods that we used to eat before the colonists came here and introduced us to commodity foods, which are high in sugar and high in carbs. We needed to get back to what made us healthy. You didn't see an obese Indian in the original times. So that's where we came from, and that's where we're going back to.
So a connection for nutrition, but a connection to your tradition as well.
Yes. The white corn, as we're reintroducing it back into the community in the form of flour that you can use in place of white flour. You can use it to make your breads, your muffins. It does not contain sugar like other corn does. And so it's healthier for us.
Darlene, it was so wonderful to see the children learning the Seneca language. Can you tell us a little bit more about how that revival of language and cultural traditions has influenced how your community is growing and thriving?
I think that the children are a prime example of daily usage. Our language and culture stay alive by using it daily, giving thanks for what they have, being aware of their environment, and culturally learning by song and dance. As you heard in the beginning of our video, they were singing. So those are some of the things that our young people look to, and these little people that we have at the Faith Keeper School, they are the ones who started. They're the seeds, and so we continue to cultivate those seeds, and every day, and the language that they learn and they retain also comes with values. And all of that was left for us by our ancestors.
As we close, what one thing would you like people here and those in the web audience to know about the experience you've had at the Seneca Nation of Indians in building a healthier community?
It took all of us to make that change. It took us bringing the entire community together, from the youth up to the elders, and recognizing how we could paint this picture together. We're not quite there. We know we have a lot more work to do, and we're going to continue this process. There's so much more that we can move forward within our community, and we will do that. We're determined that we're going to have paint a better picture for the next 7 generations.
Well, thank you for being here and allowing us to learn from you.
Thank you. Vicksburg, Mississippi, the key to the South, is a proud city that honors its history as a Civil War battleground. And they are moving, and I mean moving, forward by building and revitalizing parks, schools, education, business. Let's learn more.
Vicksburg sits atop a bluff on the Mississippi. Its fortunes flow with the river. The city's challenging history is intertwined with the Civil War battle that put it on the map. It's a complex story of struggle and social change. Now Vicksburg is pulling together like never before, rallying around common goals to groom new leaders, to revitalize the economy, to shape up and get fit.
We call Vicksburg the key to the South. It is 66% African American. It is a city that is proud.
When you start talking about community, that out of community come collaboration and cooperation and working together.
Being on the move is what I want this community to be like. Shape Up Vicksburg is a get healthy walking club. It's about making exercise an easier choice. Our parks needed improvements. The city took the pulse of the community and it came back with improvements. Healthy parks, healthy people.
My name is Miss Linda, and you are at the community garden.
We all have something in common. We all want to see the success of our children. The children are our tomorrow, and it's our responsibility to make a difference in their lives.
The important part of health and wanting to be healthy is having hope.
Welcome our teachers to the Vicksburg Warren School District Convocation.
When you begin to talk about how siloed education can become, we look for ways to make sure that we're unified.
Leader in Me is a great example of partnerships in Vicksburg.
No matter how I was born or whom I'm born to, I own me. And then you roll a kid up in the middle school where they start thinking about jobs, and then you roll them to the high school where you give them the credentials for it. It's a systematic approach that creates leaders with credentials, and that's very important to us.
Local leadership saw the value here.
We set that priority to get that downtown developed, to put more businesses downtown.
And then investors came in and started buying these bigger buildings and turn them into housing. And people are coming from our community to eat here, to live here, and that's just really cool.
Everybody feeling good?
Yes. Walk with the Doc is about getting doctors out of that hospital setting.
And we can discuss basically any topic from diet to exercise to what can I do to increase my health.
The first thing we had to do was get a partnership and collaboration, and that meant going to our local hospital here. Then we went to the Vicksburg National Military Park and asked, could they help?
The success of Vicksburg National Military Park relies on our role we play in the community. African Americans saw first major combat here during the Siege of Vicksburg, and were successful. They were triumphant. From the National Park Service's perspective, the Civil War was a war for civil rights. So here we feel very humbled that we are able to preserve part of that struggle, in a sense that quest that still continues to this day.
We're changing the way people think about Vicksburg.
It's not about any one person or any one program. It's all about us and what we can accomplish.
Everyone's mission is aligning and we're all moving in the right direction.
And the only way that we're going to make Vicksburg rise is we have to be in it together.
Well, we welcome from Vicksburg, Mississippi, Michelle Connolly, who is the Executive Director of the United Way of West Central Mississippi, and Linda Fondren, who is the founder and Executive Director of Shape Up Mississippi. And Linda, in the video, I heard you say that you are changing the way people are thinking about Vicksburg. How are you changing the narrative about health, about how people think about health in Vicksburg and Mississippi?
Well, we're frustrated with the way that people view the state of Mississippi as poor, unfit, undereducated, racially divided. We started to change this by bringing people together. I have to say that I am so thankful to our elected officials. What they did was created committees to go out into the community and to talk to the people. What is it that you would like to see? What do you want to see in your community? What would you like us to do? When we did that as a committee and reported back to the elected officials, they jumped on board because one of the things that they realized is that a community's health and our personal health are deeply connected. So we started to change that by creating an environment for change to happen.
And over the past few years, what concrete changes have you started to see?
Let's talk about education. When we look at education, only 56% of our students, high school students, were graduating. That is now at 71%. So that is absolutely excellent. When we look at the number of people that are walking now, we are number one for lack of physical activity. Even though we have so many parks that people can use, people were not using them. Now, you go to Vicksburg, watch the people that are walking. You have the mothers that are pushing their strollers. Fathers are walking with their children. People all over Vicksburg are walking. We have branded walking. Walking is cheap. Life is priceless. And to show you, so this is all over the t-shirts. And I have to tell you, one man saw a lady in Walmart and he said to her, "Ma'am, you are certainly right. You know, walking is cheap, life is priceless. My wife has cancer." So you see, people are beginning to recognize the importance of health, getting that message out there, raising awareness, and then creating the environment so that they can get out there and do something about it.
Thank you.
We saw it when we were in Vicksburg. Everyone is walking in a way that is, Linda's not kidding. And Michelle, we know that United Way stands at a place for partnership, and that the work in Vicksburg, the role of partnerships are paramount. So tell us a little bit more about how that has happened in your community.
You're absolutely correct. Partnerships are paramount to success. We are the key to the South, but partnerships are key to success. I must tell you that. And at United Way, it's extremely nice to have the opportunity to provide that table for the community to come in and have those very difficult conversations. But I want to tell you something. Partnerships, that's easy to say. True collaboration, each one of us in here can say that we are experiencing true collaboration. But that is not easy. It is our responsibility as community leaders to truly listen to our community. It is. It is paramount to the success of your community is to truly listen. Be ever present in every moment that you have to gain knowledge from another person, because you never know what you are going to learn. At the United Way of West Central Mississippi, I'm going to tell you right now that the opportunities that are there for our community to share and the opportunities there for our community to listen are amazing. On a regular basis, we will have the most elite of the elite enter the doors of the United Way of West Central Mississippi wanting to help and wanting to make a difference. And that is beautiful, I must say. But as they are leaving, that same elevator door will open, and there will be a family of 5 individuals who do not know where they are going to lay their head that evening. That's powerful, because the story that they have to share is just as important as the story that was shared around the table with the most elite. And you must remember, it is critical, it is crucial, that you must listen and respect everyone who chooses to share their story.
So for the two of you, what would you like the people here to take away from the experience that you're having in Vicksburg that might help them in their community as they're working as well to build a culture of health?
I would say that no one starts out with all the skills and the knowledge that it takes, or that it will eventually take on and achieve a big goal. But if you are bold, ambitious, committed long-term, and go to the county health rankings and roadmaps, those tools and resources will help you get there in a hurry. If you do all of those things, mountains will just move out the way for you.
Thank you.
And the one thing that I want to share with each and every one of you is you do not have to do what has always been done. It is time for us to tear down the walls, invite everyone to the table, and find solutions for our communities, especially when we are rallying around our children. I would like to commend the education, the Vicksburg-Warren School District, because they have torn down those walls. They have invited people to the community table to share what we need as a community. We are teaching our youth how to be true leaders. We are providing career skills to our high school students. And most importantly, y'all, we are doing this together.
Well, I want to thank you both for sharing your story. I don't know how you can have been here or out there and have heard these 8 communities tell their story and not come away from this jazzed up, empowered, committed to doing more, believing that a culture of health can take hold across America, because you all are living it, you're doing it, you're inspiring. Thank you for being here and sharing your stories, and we are cheering you on and are here with you all the way. So thank you. A round of applause for all of our awardees.
Awesome. Thank you. Why don't you guys go right up? Thank you. Thank you. You're welcome. Rich and Julie, I'm going to come sit with you for a minute. Let's have another round of applause for 2017 Culture of Health Prize winners. So we're going to close out the webcast at the moment. We want to thank everybody for being here today. Thank all of you at home for tuning in. 2 reminders. The Facebook Live event will be this afternoon at 4 o'clock with Rich Besser and leaders from 3 of our communities. So tune in Details on Facebook. Also, the 2018 call for applications for the Culture of Health Prize is open right now. So all of you out there watching and others who tune in later are inspired by these communities today. You can apply for the 2018 prize. Go to rwjf.org/prize. You'll see all of these stories in more detail, and you can apply there. Hashtag, if you're sharing on social, Culture of Health Prize. And with that, we will close out today's event. Thank you, Julie. Thank you, Rich.